I never dreamed that he had had a heart attack. It never dawned on me that day to call 911.
I said to him, "John, look at me, look at me."
I was in trouble. I was in real trouble.
I went and actually raced to the phone and called 911.
At 45, I suffered a stroke event. Foolishly waited an hour and 10 minutes before I told my wife, who is a nurse, that I had this event. Here, I didn't adhere to my teaching.
The most common problem we see is denial. Oh, this is indigestion, or this is my shortness of breath, or this is chest wall tenderness, oh, I was lifting something heavy last night. Any number of different things. That's not the heart.
The clock's ticking. Every minute that goes by, you're losing brain cells.
Most people tend to wait, or a lot of people tend to wait, maybe because they're stubborn. We're all a little stubborn.
For every minute a stroke happens, 1.9 million brain cells die, and they don't come back. When you start having the signs and symptoms, call 911.
Time is muscle. The longer you wait to call 911, the higher the probability that you will have significant muscle damage to your heart, which may not be repairable.
The American Heart Association has set a goal for this decade to improve cardiovascular health for all Americans by 20%, while reducing death for cardiovascular disease and stroke by 20%. Did you know that every 25 seconds an American will have some kind of heart event? Did you also know that every year 795,000 people will experience a new or recurrent stroke? Strokes account for 1 of every 18 deaths in the United States. But despite all these statistics, people with chest pain and stroke-like symptoms continue to delay seeking medical attention.
Woke up one morning to come in and do some computer work for my job, and felt this weird feeling in my leg, and that was a clot traveling. After evaluation, they found that I threw a small clot in a branch of my left temporal artery. Fortunately for me, I was young enough that it didn't cause, catastrophic, damage or irreversible damage to my body.
My daughter, 21 years old, she had only been on her own out of the house for about 6 months. She got a boyfriend. She did have a stroke, and the stroke was caused, they determined, for the birth control that she was on. They called me on the cell phone and said, "Chief, we've got your daughter. We're seeing strokes at a younger age than ever before." The strokes used to be the 70-year-olds, and then it was the 60-year-olds, and then occasionally a 50-year-old. Well, now it's uncommon to have a stroke at 40, and now it's more common to see strokes even in the 30s now. Strokes is an evolving event, and really it is truly a red light and siren event to get to the interventions that are available.
All I could understand was something about trying to get up, and I could see he was struggling to sit up, and he could not. I went to his side of the bed and tried to get him in a sitting position. He was just dead weight, and I could not get him up. I noticed that the left side of his face was drooping.
I could talk with her and see her, and she said, we need help, and I'm going to call 911. And I says, well, I'm not sure we need that yet, but she insisted.
And the paramedics came within a couple of minutes. They did a CAT scan. They verified that he had a blood clot on the right side of the brain. I was told it was the worst possible location for having a stroke.
Calling 911 to get them there, and the care they provided was just unbelievable.
The doctor decided to give him TPA, which they administered, and it took about 45 minutes. About an hour after that, it was like a miracle happened.
Would you believe that about half of all heart attacks and stroke patients do not call an ambulance? Instead, they hop in someone else's car or even drive themselves to the emergency room, risking their own lives and sometimes the lives of others.
mean, what if they pass out? What if they actually go into full cardiac arrest, which is, you know, they're not going to have the control to even try to pull over. They're just going to lose it.
But a small percentage of people will have an arrhythmia or bad rhythm of the heart as part of their heart attack. And if they were to have that while they were driving, it'd be devastating, you know, especially if the person is driving and some of these rhythms come on pretty suddenly and abruptly without any warning.
On a more regular basis, we're getting to traffic accidents that was caused because of an illness of the driver, and it could be a heart attack, but in most cases it's a stroke or a hemorrhagic bleed.
Don't drive yourself. You know, the consequences to you, the people around you, your family. If you don't do it for yourself, do it for others.
People who drive themselves risk passing out behind the wheel and causing a crash. They could also end up on the side of the road with a family member who is suddenly forced to perform CPR, or finding themselves now calling 911 to get emergency attention.
But it all has to be done rapidly, because if you wait 12 hours, even though they can do these benefits, the brain cells are already dead, and once they're dead, they don't grow back. So that's why it's so important.
Minutes lost can mean more damage to heart muscle and brain cells.
I had double bypass surgery, and my husband had a minor heart attack. You know, he works outside a lot. You know, we got all this property out here, and he would come in just broke out in cold sweat, you know, and he gets really hot, you know, and I'd worry when I'm seeing him do that. We came up here, sat down at the table, and he says, I've got this funny feeling in my chest.
Tenseness in the chest, like you're, you know, like you got some uncomfortable feeling there, and it's kind of hard to move, it's a little bit hard to breathe.
I said, I think we need to go to the emergency room. I think I was scared because he didn't fight me when I said, I think we need to go to the emergency room, and normally he would go, oh no, I'm okay, I'm just, you know, I'll be okay here in a few minutes. He didn't say anything. He said, what do I need to take? It was my idea to get him to the hospital, and I knew how to get him there. If he had gotten in trouble on the way to the hospital, he would have been a whole lot worse off than he was. We should have called 911. They have equipment that can start treating him immediately, whereas if you go in a private car, you don't have any of the people that know how to operate the equipment, and it's very important when it's your heart. You know, I was driving the car, I could not have helped him. And knowing what I know now, chest pain again, it's 911.
Over 79 million adults are living with heart disease and stroke. Many are struggling to recover from a heart attack or stroke, while others at high risk are getting the care and making changes necessary to lower their risk. Fewer than 10% of heart attack patients report that they have ever spoken with a physician about what to do in case of a heart attack. Understand the risks involved in delaying treatment of a heart attack and learn to recognize a stroke. Time lost is muscle lost and brain lost. Risk factors for heart disease and stroke include smoking, obesity, diabetes, high blood pressure, high cholesterol, and sedentary lifestyle. You can do plenty to get your heart and brain in shape even if you've had a bad experience. Healthy changes will help you feel and look better. Death rates from heart attack, stroke, and other cardiovascular disease are going down. Healthy lifestyles play a big part. Now's the time to make up your mind to take some control over your future. You'll find that once you make one change, the next comes more easily. Here are some simple steps to take. Do not smoke. Have your blood pressure checked regularly. Improve your eating habits. Be more physically active. Maintain a healthy weight. Have regular medical checkups. Take your medicine to control high blood pressure, high cholesterol, or diabetes. Some heart attack victims don't have the classic warning signs, such as pain in the center of the chest or pain in one arm or the back. Many experience shortness of breath, or have flu-like symptoms, or feel lightheaded or nauseous. Women may complain of only feeling more tired than normal.
And I kept thinking, man, I'm short of breath. So I had made an appointment with my regular doctor. I thought there was something in my lungs. Well, I ran into Dr. Alan Taylor in the hall, and I said, what do I need to do to get an appointment with you?
Most hearts have 3 blood vessels going to them, one to the right, one to the front, and one to the left side of the heart. When one of these 3 blood vessels closes off, you start having a heart attack. The goal of our therapy is to open up the vessel that is closed off.
I had some blockage at the top of the left heart. So the next Tuesday, I was in surgery for 5 hours, having bypass.
Some heart attacks are sudden and intense, but most of them start slowly with mild pain or discomfort with one or more of these symptoms. Chest discomfort, discomfort in areas of the upper body, shortness of breath with or without chest discomfort. Other signs include breaking out in a cold sweat, nausea, or lightheadedness. Symptoms of a stroke include sudden weakness or numbness of the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden severe headache with no known cause. Most importantly, if you think you're having a heart attack or a stroke, call 911 immediately. Do not drive yourself to the hospital. Emergency responders will notify the hospital when they are bringing in a heart attack or stroke victim. This allows the cardiac cath lab, radiology, and other medical specialists to be ready for your arrival. Emergency responders can send your EKG to the hospital for the ER physician to see before you even arrive. This will speed up your care. Doctors can now read the EKG and diagnose a heart attack from their computer or even their iPhone. The hospital's cath lab can then be ready and waiting when the patient arrives, shortening the amount of time it takes to open a blockage. Since the speed of treatment is crucial for heart disease and stroke, being at the right place and the right time is key. Request to be taken to an accredited chest pain or primary stroke center where appropriate and efficient protocols are in place, and the latest interventions are available 24/7. These highly skilled cardiac and stroke centers offer specialized and highly trained teams using the latest equipment and utilizing leading-edge procedures.
We've got the ability to look at your heart with our cardiac monitor and tell, and we can get that information to the doctor quicker, and they can have a whole team of people ready like that. I mean, just quick. We've also got medications that we can give that can also help with that blood flow, help restore some of that blood flow to your heart.
To get them immediately to the hospital as quickly as possible, to the appropriate hospital, not just any hospital.
Not all hospitals can deal with your situation. And we think with, just because it's a hospital says emergency room out there, but you have a special problem that needs to go to a hospital that's equipped and trained and certified to handle these situations.
Not only that, but our vehicles can have a locator system where it actually tells us where we're going, where the call is at. It'll turn lights that are red to green so that the traffic can flow.
And that's where all these technologies come in. This is where 911 comes in. You know, yeah, maybe I could wait 3 hours. Maybe I could get my neighbor to drive me up to the hospital, and I might live that event. But you're not going to have any quality of life after that.
If somebody walks in through the hospital, you know, through the ED doors, now they have to activate everything. And they may lose 5 minutes, 10 minutes, and that's every minute is muscle.
A clot in the heart is a heart attack. A clot in the lung is a pulmonary embolus. A clot in the head is a stroke. So it's blockage in any vasculature.
The longer you wait, the more increased risk that you have to suffering some sort of permanent defect. You could have, you know, loss of sensation in your body, loss of speech. If you're having a heart attack, you know, if we don't get that blood flow returned, you know, a normal amount of time, part of your heart can be damaged so bad that you can go into congestive heart failure.
It's not enough in a stroke just to save your life. We want to save your quality of life. And that's where we set our benchmarks.
Why do people not call 911? The number one answer is they don't want ambulances and fire trucks to arrive in their neighborhood, lights flashing and their neighbors wondering what's going on. Other studies reveal that many of the chest pain patients delay calling 911 because they took an aspirin or attributed their symptoms to heartburn and took an antacid instead.
When you start having the signs and symptoms, call 911.
You know, 20 years ago, they couldn't do what they can do now. You know, if you've got some blockage that's caused this, they can fix that.
If people knew the good things that can come from it, like our experience, then they will be a lot more alert and willing and eager to call and use 911 as it should be used.
You know, don't put it off because of money. Because I can't afford the ambulance bill. I can't afford the hospital bill. No, you can't afford to have this happen yourself or to your spouse, because now you're talking about a situation you're dealing with is even financially, you know, when it gets to the point of rehab and hospital beds and that type of care you're going to have to do.
Call 911, get the paramedics there, let us decide whether it's an emergency, let us decide whether it's a cardiac event.
Call 911. Let the paramedics decide.
Don't be embarrassed to death.
Call 911.
Call 911.
Don't be embarrassed to death. Call 911.
This message is brought to you by the North Central Texas Trauma Regional Advisory Council, an organization dedicated to support and improving all emergency health care through prevention, education advocacy, research, preparedness, and response.